So, scar massage.
Mhm.
I have to say, even with all of my knowledge around birth and postnatal, I didn't even know what scar massage was for a long time. And certainly no one had mentioned it to me in my birthing journey.
Mm.
Sometimes a midwife might mention it to you in your appointments, but usually that's quite cursory. Are you doing a scar massage?
Mm.
Do you know you should be? But actually, what does that mean? So, you know, let's go from the beginning. What is scar massage and how can it help?
Yeah. So scar massage is starting to help the tissues around the vulva and inside the vagina opening to stay free of the surfaces that they're attached to. I think it's easiest to break it into the 3 stages
Mhm.
that you will want to go through, but there's no specific timeline about when you would tackle them. I just
Okay.
give you a rough idea. So before the first 6 weeks of healing, you rely on natural movement to produce a healthy, robust scar and let it really knit together nicely before you try to add in anything yourself.
Mhm.
But very early on, you will be washing and caring for the area. So don't be afraid to touch
Yeah.
from the very beginning, because every time you're touching the area
Yeah.
to wipe yourself or to put some moisture on or to just care for the wounds,
Yeah.
you're reminding your brain that this is still an area of your body that you are linked to.
Yeah.
And you won't become afraid of the area or nervous of the area. And I think that's the biggest problem, is that people start to disconnect very
Mhm.
quickly.
Mhm.
And as soon as you feel that the scars are healing well, and your midwife has checked or the health has checked, it's all coming along nicely, you can actually on purpose touch the area all around. You might like to do that in the bath, in water, or in bed, propped up with some pillows, with a little bit of lubricant that your body's used to on your fingers, and you can sweep around the opening of the vagina, round the back passage, across this center band of tissue called the perineal body, and lots of lovely light touch.
Mhm.
If you feel fingers isn't for you, you can wear gloves. As long as your fingers are clean fingers, that's fine. Gloves, or a piece of nice big chunky bit of cotton wool. Or I've also heard people using a makeup brush,
Mhm. Lovely.
or even just some soft fabric or gauze, or a soft scarf, something that you feel you'd be able to tolerate and
Yeah.
enjoy.
And what should that start to feel like? Because I guess a lot of us might be experiencing a bit of numbness, so we
Mm.
should start to feel a bit more sensation
Yeah.
coming back and so on.
Yes, so if what you were feeling was that you've lost sensation, you'll start to feel sensation returning.
Mhm.
And if what you were feeling was hypersensitivity, almost that touch feels painful and unpleasant, you'll start to feel that touch is becoming more tolerable and comfortable
Mhm.
again. So it will go whichever way you want.
It's very clever, isn't it?
Yes, and I think it's just that you are touching your nerve endings and reminding your brain that this is not a scary situation.
Yeah.
This is okay. Let's normalize
Yeah.
feelings. I sometimes think of stroking a cat.
Yeah.
You're just going to stroke gently like you're a bit of a twitchy cat. And actually, if you sit there and stroke the cat, it will calm down and go,
Yeah.
okay, you can stroke me now.
Yeah.
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 A soothing touch.
Yeah.
And then the second phase, when you're comfortable with touch, would be to go a little bit more movement, so that on purpose, you're going to take some of those higgledy-piggledy bits
Mhm.
and make sure that they're not getting set in their ways.
Mhm.
So particularly this space between the back passage and the opening of the vagina, called the perineal body, this is the most likely place you may have had a cut or a tear,
Yeah.
or just coming round to one side or round to the other side. If we think of a clock, we call this 6 o'clock, 12 o'clock, 3 and 9. And so we're trying to come 3 to 6, 6 to 9. And now what we want to do is actually move the skin relative to the layer underneath.
Okay.
And obviously it's different, we haven't got a person willing to be a volunteer here, funnily, but a very similar place would be your top lip.
Right.
So if you put the pads of your fingers on your top lip, you can move your top lip side to side and up and down and make circles
Over the top of your teeth.
over the top of your teeth.
Yeah.
But do you see how it moves?
Yeah.
And
Yeah.
it doesn't hurt.
No.
But can you imagine that if there had been some work there, you might find that when you move it to the right, no problem at all. But when you go left, it feels a bit stingy or a bit pulley. And you think, oh, maybe I mustn't do that. But you should.
Okay.
It's really important to go into the bit of discomfort and give it a little bit of a stretch and remind those fibers that are forming that they must form long enough.
Yeah.
They must give you the ability to move from side to side and up and down.
But we're not talking about lots and lots of pain in
No.
terms of...
So if you say 0 is no pain and 10 is severe pain, you're looking at something under 5, around about 3 to 5 is perfectly acceptable.
Okay.
It's a bit uncomfortable, but your brain will tell you, but I think it's a good idea. We call it good hurt, or therapeutic hurt. It's like, I know I need to do this because if I don't do this, I'm going to get stuck here.
Yeah.
But if it's more painful than that, then you should definitely be asking advice, because it might mean that the stitches aren't very well aligned. So you're trying to, it's hard for them to stitch. It's messy, they've got to have lights. Sometimes the tissues aren't lined up as well as they could be. Or you can get something called granulation tissue, which is kind of an overexerted repair work going on, and that can be painful. Or you could have an infection. So if you're like, no, this really hurts, then that's not what we mean by scar massage. Okay. And you're not going to push into that.
And so that's the sort of surface level tissue that we're trying to move.
Yeah.
And then would we move on after that to a different phase?
Absolutely. So when you feel, okay, I'm comfortable, I can move the outside tissues in this sort of arc area, then the next thing is to put your thumb or finger inside the opening of the vagina here. And I'm going to use my mouth tissue as an example. So you put your thumb inside and finger on the outside. And then you can roll the tissues and you can sweep them.
Fascinating.
And the tissue inside the opening of the vagina is very like the inside of the mouth. So maybe have a little play in your mouth first, that really just gentle sweeping, not too much pressure. You can feel, you can feel it's going to bring blood flow. It's going to tell the tissues which way we want them to grow and heal and develop to keep it flexible. And those are your surface muscles. Now, these surface muscles are the ones that have to open and stretch for penetrative sex or foreplay. And if they don't like being stretched and they're not used to being stretched, you get these messages of, oh, I'm not sure you should do that. And we would interpret that as fear or hold back or tense up. But if you're used to doing it on yourself, then the next step is for your partner to do that for you, or at the opening. And that's your start of returning to foreplay. And then your next layer, deeper inside, are your deep layer of pelvic floor muscles. And you might not be aware of these until you try to have penetrative sex. And then you might feel that you got to the opening, no problem, but going further seemed difficult. So to explore these, you have to put your finger or thumb deeper inside the vagina. So thinking the first layer is the first knuckle and the second knuckle, but really right into the third knuckle. And then it's like feeling your cheeks and the back of your tongue. And you're having a feel around, looking for, have I got some, we don't call them trigger points anymore, we call them tender spots. Areas that seem very reactive or uncomfortable, don't seem to want to give like they did before. And then again, you would focus your massage on those areas, sweeping, circles, pressure, to help to get used to that sensation, bring blood flow back to those tissues. And if there are some higgledy-piggledy bits forming, then it would help to just stretch them out, let them understand that they need to be able to go any which way you want them to.
And when you're feeling a little bit deeper inside, would you do that just with fingers, or are there tools that can be used as well? Where's the best place to start?
Lots of choices, really. So if you're going to use your hands, you just need clean hands and a bit of lubricant on a finger or a thumb. Sometimes a thumb's a better angle on yourself. But some people prefer to wear a glove, which you can do. It'd just be a little bit less sensitive to feel for yourself. And alternatives, if you don't want to use your fingers, would be to use a small dilator, which is like a fixed plastic tube that you can purchase, and they come in sets of different sizes. So that's like a rigid finger.
Okay.
Or you could use a small vaginal vibrator, or you can buy something called a therapeutic wand, which generally are made of glass or a heat-proof plastic, and they are a little bit shaped, sometimes a bit curved and a bit longer, and you could use a tool like that to help to do the stretching for you.
And will you be able to, if you're doing it with your fingers, are you able to feel any raised areas, or does it depend on the scar itself from person to person, or would you only be able to feel it from the sensitivity from the wall side, if that makes sense? Are you able to feel any kind of ridges or anything in your in your fingers?
I think some people are sensitive enough with their fingertip touch to be able to tell where the actual scar was.
Yeah.
But it's a little bit like reading Braille. You might not have that sensitivity in your fingers, so it'll all just feel samey to you.
Yeah.
If it's a very raised ridge, or an area of tissue that seems to just be tightening by itself, it'll be more obvious. Have you ever bitten the inside of your cheek and ended up with a ridge?
Yes.
And you get those funny ridges in your mouth, don't you? And if you stretch them, it kind of hurts to stretch them, but you again know it's kind of not a bad thing.
Yeah.
And once you've stretched them, even for like a gentle minute, it's like they disappear. So I think those might be more obvious than the actual scar itself to somebody who that isn't their job to feel scars.
Yeah.
But this is where someone like me has a job, because this is out of sight, internal. We've trained our fingers to be able to feel things that we wouldn't expect you to feel. So I think if you're getting a bit confused about what you're trying to get to and where and what to do for it, that's when you do want to bring your support team on and have a little lesson on you, and your physio will draw for you exactly where your scar is, where you should aim for, and help you to get a better understanding of your own personal situation. But still have a go yourself first, definitely, because scar massage and tissue massage can be really powerful, like 1 or 2 sessions of just making friends with your pelvis again. You can move on leaps and bounds. There are people that need to do their scar massage for a long time, but many more people that are like a couple of sessions, oh, this is so much better already. And it's never too late. So just because you didn't do it at 6 weeks and 12 weeks, your child could be 2, and it's worth revisiting your abdominal caesarean scar or an internal scar. And you'll be really surprised how much scars love to be massaged for years ahead.
I think that's a really important point as well. Don't think because you didn't do it when you were first newly postnatal that it's not worth doing now. It's always worth spending time on you and getting to know your body anyway, and seeing where those tender spots are, and seeing if they can be improved. So I think it's a really, really valuable way of spending your time.